The U.S. is on a growing list of countries imposing new COVID restrictions for travelers coming from China. This due to the continuous surge in infections in that country. So to put this into perspective, Italy says nearly half of the passengers on two recent flights from China to Milan tested positive for COVID. Joining us live to discuss the restrictions, what it means for travel, and the latest on China's outbreak, Dr. Corey Hebert. He's a professor at the LSU School of Medicine. Doctor, it's good to see you again. Thanks for being here.
Happy New Year to you very early, but yes, it's good to be here.
Thank you. So let's talk about this new rule. Starting January 5th, to enter the U.S., a passenger from China needs to show a negative test from a 48-hour window prior to flying. Is that enough? And is there a concern about COVID coming to the U.S. from China?
Yeah, I'm very concerned about this right now. And the reason why, I really don't think that that's enough of a window, because we do know that you can test negative and actually still be positive because of the false negative rate of the rapid test. The issue, though, is there have been over 250 million new cases of COVID-19 in the first 20 days of December in China. That number is huge, obviously. But the bigger issue is that China has not been very forthright with their information since the beginning of the pandemic, including how this whole thing started. So we cannot really trust the data coming out of China, especially when knowing we've had that many new infections, and they're not really letting us know how much, what are the numbers of the death toll at this point. Those numbers are a little bit sketchy. So what we can do as Americans is we can't really control what happens in China. But what we can control are the amount of people coming into China. And another thing we control is what we do here to stop the transmission if people come from other countries, not just China, wherever you come from, to come visit our great country. We have to do what we need to do, which means wash up, mask up, separate, and vaccinate. That is my mantra. It's been my mantra for 2.5 years, and that continues to be my mantra because people are getting COVID right now in America, and people are still dying.
Well, and doctor, can I ask, places like Italy, as we said, seeing the two flights into Milan where almost 50% of the passengers were COVID positive. Now, they're issuing a negative test upon arrival rule. Would that be a better idea here than the 48-hour window? Why wouldn't we do that?
Yeah, I think we should do the 48-hour window and as well as upon arrival. And the reason why is because people can fabricate tests. That's the first reason. And then there is a real false negative amount of tests that are going to happen because that's just the nature of testing. So we have to be very careful. But I mean, I travel a lot, at least once a week, and I'm in the airports and people aren't even washing their hands anymore. People are being, it's a holiday time. People are congregating in huge numbers with family, which we want people to do. But you've got to be careful, especially get your boosters. The new boosters are addressing the variants that are out there. The new boosters are not being well received. People think this whole thing is over. And no matter how rare it is not rare by no means. Everyone out there right now knows someone that is suffering with either long COVID or with acute COVID that's having a problem. Everyone out there. The bigger issue, though, is that we have to look at the immunocompromised people. We have to look at the children. We have to look at the folks that are over the age of 65, people that have pre-existing illnesses. We have to look at them because, sure, you could actually get COVID and be absolutely fine. But if someone gets COVID and they die, no matter how rare you think it is, if it happens to you, it's 100%, and it's not worth it, especially what we know how to prevent it.
Doctor, one more question for you. As you said, there are concerns worldwide that China is not being transparent, that officials may not quickly inform or inform at all the rest of the world about any new variants that may have emerged either. How valid is that concern given that we saw 37 million cases in one day in China this month, and yet the government is only admitting to 7 deaths in the entire country in 2 weeks?
Correct. Yeah, we know that China has not been transparent. And I will say, we know that with this many cases of people getting COVID, 250 million in less than a month, the new variants will emerge. That's what happens. And when new variants emerge and you don't have a booster, then your chances of having a very serious morbidity or mortality rise. I can't even. The way that you have to think about this is a life or death situation for you and your family, and you have to make decisions now on how you want to handle it. And that is why you must wash up, mask up, separate, and continue to vaccinate so that we can get over this thing. So next year, I won't have to come on and talk about this like I've done every other Christmas for the Thanksgiving for the last 2.5 years.
I hear you. Dr. Hebert, thank you so much for your time, and Happy New Year to you again.
You as well.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.